Good afternoon, dignitaries, Madam Rabika, other dignitaries, LC mentors, entrepreneurs, their families, their children, मेरी तरफ से सबों को सलाम। मैं इस वक्त जहां पर खड़ा हूं, मैं ये नहीं कह सकता हूं कि मैंने कुछ अचीव किया है, लेकिन एक बात जरूर है कि मैं एक वो बच्चा अभी भी अपने आप को समझता हूं जिसकी जर्नी शुरू ही है फ्रॉम द ग्रीन पास्चर्स ऑफ द बॉर्डर डिस्ट्रिक्ट, द एस्पिरेशनल डिस्ट्रिक्ट, दैट इज Kupwara, where our soldiers, our officers give their duties at night, and during the day they are serving the people along with us, reaching the common people in the tough terrains where the connectivity is no. So this is an achievement for me to reach at this stage from that border district of the country, which is just across our neighbor. My journey has started from humble beginnings. My parents were illiterate, but one thing for the children who are here, young Agrawal and Siddharth, I had the positive thoughts from the parent story. They used to tell me whatever you can achieve is through education. And that education designed me the thoughts what the Dr. Rishi Acharya said about the law of attraction and the positive thoughts. Always I carried with them without having the books at the time in 70s. If we open this, you will see the school I have joined. The wooden school, the no connectivity. We had to borrow the books. We had to not even the full meal to eat. But there was one belief, one desire that I should get something. So at the age of 8, I did dream of becoming a doctor, because from the story of my father, at that time only the doctor and engineer, our commander-in-chief was the man in that area. Think of the 70s, the rural area, the far-flung, the aspirational citadel in 21st century. So I did get 25th position in my matriculation, J&K board at that time, without having the books, without having the coaching, competing, and enter my medical school on 17th serial in open merit. I did MD medicine from the prestigious Institute of Sher Kashmir Institute of Medical Sciences. My 3 years in gastroenterology. I worked across different countries. There I gained MRCP, did my work, research work, almost 80 publications in prestigious journals of the world, that's British Medical Journal, Infectious Disease Clinical Practice, with more than 130 citations. The concept of the quality. Dr. Pijlani one day said that his customer told him your product doesn't have quality, so he moved to a country where he is not producing the quality. The quality is the concept in the rest of the countries I used to work, but whatever the experience I got, advanced cardiac life support, advanced trauma life support, I was a doctor, the best paid there. I was the doctor, you know, the healthcare, whosoever gives the healthcare in any part of the world, he is well respected. But still, having got the knowledge and skills, something was haunting me. What about those people who were poor like me and living in the different far-flung areas? What did I give to them? Sir, the choice was either to have the luxurious and the green pastures, not the green pastures of the tough terrains I had come from, the green pastures of Australia, New Zealand, UK, go there, easily enjoy. But service to your people means patriotism. It came to me when you interact with the different nationalities, you realize you are holding the passport of your country. If it is in my pocket, that makes you proud and that makes you identity, and literally it is. You become a patriotic, you become a nationalistic. If these things are in any individual, nobody is going to hinder his success. Whatever he wants to achieve in his life, the belief, the positive thoughts, the struggle, he has not the consistency, as Ajay sir said, he will achieve it. After serving there, I thought, okay, back to the people. Service is important, and service is the patriotism. So those people who do earn in our country and to invest in the rest of the countries, I cannot say they may be providing the jobs. They may be the other nationalities getting the good money there. But is this the patriotism? The poor men paying them for the stars and they making the big malls or the big avenues in the rest of the world. Provide jobs to your own people. Provide service to their own people. Provide to those unreachable, those people whom nobody cares. So I went back. I had seen the people from different parts of the rural parts being carried in load carriers because of the tertiary care hospitals are 100, 120 kilometers away. See, our 70% of the population is rural and peripheral. Only 30% is urban. But if you take the healthcare infrastructure, 70% is urban and metropolitan. Only 30% less than that is rural and peripheral. This much disparity. These rural people, they work in your industry. They are the agriculturists who produce the food for you. During the COVID, this agriculturist, which gives the 35% of the GDP to our country, he made us to resist the COVID impact. So he should be healthy. If he is healthy, the industry is collapsed because the people were traveling with their bags home for 1 year. So we should not think of those people. And every person has the right of equal health care. The people, the right of having the good facilities in the cities should have the peripheral also. So there came the dream when I used to see the people moving from different parts being carried in road carriers, the ambulances, dying either on the way because of missing the golden hour, which is important to the survival of a heart attack, the sepsis, the trauma, whatever. I thought, why not to decentralize the tertiary care? I have been working as a consultant in Medical College Srinagar. I did not see there the medical ICU or the triage. I did establish that. But the pain that was there to improve the peripheral health care was there. See, as going to the back, everybody asked me, why rural? Can you survive? What are you doing? But the belief with me, the conviction with me was that I have to change the mindset. The mindset is changed by when I joined the LC members, the mentors like Dr. Ajay Shesh, Dr. Ishi Acharya, talking about the emotional intelligence. And 9 years, see, I am proud to have established that institution by the name of quality healthcare, word quality. The quality everywhere. If we have to grow, we heard from the sir, the word quality everywhere. He's taking I saw him the director, half of the world, the director of the health safety. And rest who are the entrepreneurs there. You are contributing your bit. But the Quality Healthcare Hospital became the first NABH rural accredited hospital multi-specialty. We provide hemodialysis, urology, all the essential services at the doorstep. We work in collaboration with our brave armed forces. We hold the outreach program in the tough terrain, which was cut off for 6 months. So, a great tribute to our officers and our Indian Army, who during the night guard our borders, and during the day, they are with us, with the healthcare workers, to give the service to the common people. So, in national building, if the warriors in uniform and healthcare workers and the other people join, our country will become great. For the vision of the Viksit Bharat, we, the entrepreneurs, are contributing. You are writing a chapter. A great applause this time. You are writing the chapter for the future. 22 years only left. The youth should be motivated by this. Thanks to the LC people who organized this. The youth, these 22 years, see, our time is gone. We may be 50, 57, 58. We can only inspire those people. but they have to contribute to the Viksit Bharat. We have to grow more entrepreneurs. I was very much pleased when Dr. Acharya had the Saturday classes for the university students. I told them, my comment was that the future India, because this is the age, they have to contribute for the Viksit Bharat. So, my tribute to all those entrepreneurs who are contributing toward the Viksit Bharat. Do manufacture the quality, develop the quality, motivate others to render the services. My mission is believe in whatever the fears there, these should not be there. The positive thinking, the positive attitude, the struggle, all of us should carry with. And if I am born in, the roots are in Kopara, my country made me the entrepreneur, my mentors give me the vision and the support. For the first time, 2 weeks, I have left my hospital on to others to see that whether the automation works. Thanks to my mentors, thanks a lot. We want, like this purpose healthcare in Kopara, this is a mission, this is a vision for the rest of the country, this is a guidance, this is a benchmark to be applied all over country in the peripheral areas. All the board tough terrains, all those who don't have the access to health care. I do provide health care to the poor people at an affordable cost, and that also quality health care. I will tell you an example. The surgery which costs us in corporate sectors, like the big hospitals there, 1,75,000. In my hospital, it costs us 24 or 25,000 with 3 modern operation theaters. We have the critical care ambulance dedicated to our armed forces, 1 model OT dedicated to our armed forces in case of war, in case of peace. Because they are also safeguarding in tough terrains, in tough borders, in harsh weather conditions, our country. When our country is safe, we are strong. So for the Viksit Bharat, again, the message is simple. We have to work hard. We have to join as entrepreneurs. We have to maintain the service, give the service, the profit comes. I have not made this hospital for the profit, but the profit is coming there. I'm sure this model will be used all over the country, all over the war-torn countries, in the developing countries, how to provide the quality health care to people who deserve it. As per the WHO, everybody has the right to good health care. Thank you very much. God bless you all. Jai Hind.